Welcome to Brain Wellness, the podcast. I'm your host, Mandy NP. What started as all things related to brain health and wellness has morphed into largely brain injury health and wellness, with occasional other neurological topics. My mission remains the same, to help you on the path to a healthier brain. So, without further ado, let's get into the show. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. My guest today is Peggy Reisher. Peggy is the Executive Director of the Brain Injury Association of Nebraska, where she has led the organization since 2013. With more than 30 years of experience in brain injury, Peggy is a passionate advocate dedicated to improving the lives of individuals with brain injury and their families through education, advocacy, support, and systems change. She has developed innovative initiatives in resource facilitation, juvenile justice, domestic violence, and public policy, and serves on the board of directors for the Brain Injury Association of America. Peggy is a nationally recognized speaker who enjoys helping professionals better understand the often hidden effects of brain injury and practical strategies for improving outcomes. Thank you so much for joining me today, Peggy.
Thank you for having me.
Yeah. So this is on my journey of trying to cover the brain injury resources in all 50 states is my goal. Started with, where did I start? Connecticut earlier this year. And it's been just kind of really neat to see how things differ in every state, and kind of seeing the things that you do is really exciting too. So, but before we get into that, can you tell me a little bit about just what led you to doing this? How did you get to where you are today?
Well, I think it was a God thing. It was, I have my master's in social work, and my first job out of college was it was actually in Indianapolis, Indiana, where I worked with some individuals who had a history of brain injury. And I can remember they asked me at the time, like, what's your understanding of brain injury? I'm like, nothing. They're like, well, we'll teach you along the way. So for that, I was thankful. It was a program that helped move people into the community. My husband and I then moved back to Nebraska, and I took a job at Madonna Rehabilitation Hospitals as a social worker on the brain injury unit. It was there that I helped, come up with discharge plans for folks, only to find there's not much out there. And we had some federal funding come to Nebraska, and kind of stopped looking over my shoulder like, who's going to fix it? And you start looking in the mirror like, maybe I should do something about that. And then so I helped start our organization back in 2010, but took over in 2013. So yeah, I had no brain injury in my personal experience, but have such a passion for this work.
Yeah, that's awesome. I always think that it's interesting how people get into what they're doing. Sometimes it's by accident. Sometimes it's on purpose. Sometimes it happens. Like with mine, I had my own brain injury, and I was very happy in the stroke world. And it's just a different kind of brain injury, I suppose. But it was not ever something I intended to work in either. But so glad that I'm here now. So it's always fun to kind of see that passion in others too, and what you're doing and how you're doing it. So you guys do things a little bit different, but what are kind of some of the resources that you provide? I want to talk more about that juvenile justice in a moment too, but kind of other than that maybe.
As a nonprofit and Brain Injury Association Nebraska, I think we do similar stuff as other associations, but we end up kind of following the money. Initially, we did a lot of work in the areas of concussion and veterans because that's where money was. And I think so much of what my goal as the leader of our organization is like, we need to have our community needs to have a better understanding of brain injury. Like, that's how people are successful, is in the community. And recognized in my days at Madonna, we were a snapshot into the lives of brain injury. It's like, got a whole rest of our life. And so our team, we have a team there's 13 of us on our staff, and 10 of them are resource facilitators. We're really knocking on doors, working with community partners to say, what can we do to better support individuals with brain injury? So we do a lot of education. I know that there will never be enough of our staff to serve all the needs of people with brain injury. So if what we can do is help other programs understand what brain injury is about, they can better serve the folks that they work with. And so really, trying to focus in high risk populations, domestic violence. We've done some work in there, working in corrections. We haven't done as much in homeless areas as I wish, but I think we haven't had funding to focus in that. But really just trying to get community partners to better understand. And we do track how many different referrals we get from different agencies across the state. It helps us understand that we are making a difference. So that's been pretty cool to see.
Yeah, yeah. So I do want to take a little bit of time to focus on that the juvenile justice system a little bit, because that's one thing I think you guys do that is different from other organizations I've talked to. How did you guys get involved with that?
You know, it's a little bit of a progression. We had gotten a small grant to work in domestic violence from an injury prevention grant. And we're like, oh my gosh, at that time when we screened individuals within the domestic violence program, it was just the adults. About 58% of them were screening with a possible probable history of brain injury. And we're like, we never asked once about the kids. But what we did is we took that data point and started knocking on doors of those working within the juvenile justice system and just said, these kids a lot of them are victims of domestic violence. Like, would you mind if we did some screening? And we'd receive some more grant funds to focus in that area. And at this point, because we've continued to have the data that shows a high prevalence of it, we've been able to create some systems change. I love early adopters. I love people that go, tell me more. And we want you in and do some screening. So with some grant funds and some amazing partners, we've been able to go into a couple detention programs, kid jails here in our state, and screen everybody that comes through those programs. We did that back in 2024, excuse me. Kind of took a break in 2025 and did it again in 2026. And we are finding anywhere from 75 to 85 of those kids are screening with a possible probable history of brain injury. And numbers talk, data talks. Yeah. And so we've then taken that to not just those working, and we purposely went deep in the system. We're like, if kids have this rate of brain injury this deep in the system, we need to do some upstream work. And so working then with, now we're working with probation and some judges and public defenders, county attorneys to say, we need to do some screening a little further up. What can we learn about this? And it's been nothing short of fascinating. We're starting to see the systems change where some of those programs that are engaged with us are like, we can't unsee what you've shown us. And one of the detention programs, we asked, we then survey the heck out of people, like, do you feel like you learned something? About 80% of those that took the training and have been around us are like, this is fascinating. Yes, we've definitely learned things. When asked, do you think we should keep doing this work? Over 70% of those within those detention centers, those officers, like, yeah, this is important. And for me, that's value. It's like, to hear, sometimes it's hard to get a program to go, I want to do one more thing.
Yeah.
Especially in detention, but this group is like, this is important work. And we've also tried to work a lot with our behavioral health programs because we know these kids look like ADHD. They look like their behavioral health issues. And we're like, it might be, or very well, it could be. But what we're saying is, can you at least add the possibility of brain injury being a reason for this won't versus can't? And
yeah,
it's been really rewarding to see how systems change with it.
Yeah, yeah. Well, ADHD and even some of the neurodivergent characteristics can come up after a brain injury as well. So it doesn't have to be an either or on the ADHD and brain injury either.
But initially we got some pushback. People are like, well, I know it's not that versus this. And it's like, I don't have a biomarker for you right now.
Yeah.
I don't know. But when you look at the prevalence and what we've done with the work is not only have we screened for possible probable, but then we've also paired that with the symptom questionnaire. Now it's called the brain injury symptom questionnaire that's created out of Colorado. And, what we found is whether kids a youth screened with a possible, probable, or not, we asked those same symptoms, all those same symptoms, and there was statistical differences between those that screened positive versus those that didn't. So we're kind of like, look, making this stuff up. But, and we also, a lot of people are like, but there's no diagnosis of it. It's like, yep, I get that. Nobody's asking the question. We're looking at how many of these kids have an AP or 504 with brain injury. Very, very few do. Part of our upstream conversation is like, be really neat if we could start screening at the school level and not waiting till they get this deep into the system.
Yeah. I want to say one of the last federal statistics I saw, or national statistics I saw about kids getting supports with brain injury in schools was like 10 or 12%.
Yeah.
So it's so low.
And the other thing that's been, this is fascinating to me, but the thing that's been also fascinating is I think people think, these youth, it's a sports-related injury. It's like, yes, that is part of it, but it's playground. We're asking about anoxic injuries due to strangulation, due to opioid overdose, due to near drowning, the choking game. So we're asking questions about anoxic and hypoxic injuries. We're asking about car accidents, slipping on ice, horse injuries, near blast explosion. I mean, we're asking the whole gamut. We're using the OSU TBI screener. And, so it's not just because they played football or soccer. And on average, these youth are experiencing at least 4 injuries. Those that are screening with possible, probable, on average 4 injuries. And, it goes back to we need to be at recognizing, identifying, and helping them manage it at a much earlier level than this.
Mm-hmm. So I was going to ask you, what does the screening look like and who's doing the screenings?
So within this particular project that we have been grant funded, it's a member of our team that is going in and we're using the OBIS, the online brain injuries screening and support system that NASHA put together. Originally, we had just used the OSU TBI screener and then the symptom questionnaire, but right now we're using the OBIS. We are finding some of our partners, like we have a public defender that is doing screenings for all of the individuals he's serving, taking that to his probation and taking that to court. So he and his team are doing that. Yeah. So I think we've got some good validity in what we're doing because we have just one person asking all the youth within those juvenile justice centers. But again, we're happy to get anybody to screen, like, the public defender.
Yeah. Yeah. So they screen positive. What's next?
For us, within this, again, special project here, grant funded, but we are then taking it, they have multidisciplinary team within the juvenile justice system or within that detention center. And, MDT includes probation, some public defenders, DHHS workers, mental health practitioners. And if those team members all agree that we'd like to do a second cognitive screen, and then it's at that point we also starting to have conversations with families saying, hey, your youth identified as a possible probable, making it very clear it's not a diagnosis, very clear this is not a diagnosis. Would you like to learn more? And so getting those families engaged. It's still been very hard to get the families engaged. Unfortunately, we haven't found that magic potion of making that happen. But again, I think we know systems change takes time. We're just delighted to see the systems partners be interested in knowing how they can build that in and using that when working with the youth. One of the things we found is a lot of those youth are struggling with attention and concentration. In a detention center, there's lots of noise and lots of, stuff going on around. And so, giving the staff there, it's like important conversation. Need to find a quiet spot, and the other thing that we've been doing with this project is also then going in and using it's called the AHEAD modules, doing some skills building training with each of the youth on the unit, regardless of brain injury or not. Our staff and our partners at the university are going in and teaching these kids more about brain injury and attention, brain injury and anger, brain injury, emotional regulation. So not only are they getting screened, but we're using this as an opportunity for education for at least the youth too.
Yeah. Where'd you say those modules came from?
Colorado.
Okay.
With all good things seems to come out of Colorado. No, but they build, it's called a head. I couldn't tell you what a head stands for, but it's a series of seven weeks of modules. And the kids have been really receptive to that and asking a lot of questions and wanting to learn more. So.
Yeah. Is it designed for like under 18?
Yeah. Yeah. We've modified it. I think the original ahead modules are meant to be, is it 60 or 90 minutes? Apologize for those who know the head modules better. We find
Yeah.
that we do a condensed version. We have about 30 minutes with the youth because otherwise their attention span goes out the window. So, and our partners here in Nebraska, we call Monroe Meyer Institute, have been also helping us get the youth through those modules. And we usually do, it's usually 10 to 12 folks in a group.
Yeah. Yeah. What kind of impact are you seeing at this point?
You know, I think the biggest impact we see is just like what our evaluations are showing us when we're talking to the professionals. That's the ones we're really trying to like, how can you meet those youth's needs differently? And how did knowing about brain injury change the way in which you are working with them and your set of expectations? And it's not a free pass for bad behavior. We make that very clear. But if we as professionals can start using our skills that we learn in our trainings towards helping those youth be supported, that makes all the difference in the world. And it kind of shifts that is it won't versus can't. And I think what's been super cool is just the light bulb that goes on over people's heads. Like, I've never really thought about that. Now they start to think about it on a regular basis. Like, could this be brain injury?
Yeah.
That's good. That feels good to me.
Yeah. Yeah. So, kind of a related yet unrelated question. If we're thinking about all of these kids that have injuries that are not sports related, and we kind of talked about that briefly earlier, for all your years that you've been doing this, have you seen a difference in what kind of supports might be necessary for someone with domestic violence in the juvenile detention center versus somebody who is not in that situation?
I think, I feel like as a community, we've done better getting youth with sports related injuries. People are paying attention. They've got an athletic trainer watching over them, or the parents are like, I gotta go to the doctor. They might get different accommodations made within the school. Anyway, I hope to God they are. But with these kids who are non-sports related, there's nobody paying attention. They're falling through the cracks. They're struggling to keep up in the classroom. And it's like, they need just as much help as those youth who have been identified as being followed by their sports, the athletic trainer in the school. The other thing that's been, really interesting and important to recognize is like some of these injuries were as children, playground injuries, domestic violence, domestic violence situation. Parents aren't stepping up and going, oh yeah, I beat my kid last night. So therefore they're going to probably have a harder time today. It's like,
Yeah.
I think our community needs to be paying attention to that. Teachers need to be paying attention. Like, what could possibly be going on at home?
Yeah.
Was there injury? And not just think these are bad kids. Like, could there be other reasons why they're struggling?
Yeah. When you said earlier that it's difficult to get the families to engage, I kind of wondered if that could be part of it, if the families are part of the reason why they have the brain injury.
And as we ask the screening questions, we don't say who beat you.
Right.
It's always have you, it's meant to
Have you
be
experienced this?
vulnerable.
Yeah.
Have you had an experience where you've been hit in the head, assaulted, or or whatnot? And we don't ask the who because
Right.
that gets into like, okay, legal stuff. So
Yep.
a very high level. I think the other thing that's been interesting shift or what we've been preaching is I think a lot of times systems will go, oh, well, they all need a neuropsych eval. We don't have enough neuropsychologists. Some of them could probably benefit from that. Is the biggest difference. If you Joe Schmo, you Joanne Schmo, go, okay, I need to, you're having a harder time processing information. I need to slow my rate of information down. That will mean more to that youth than any neuropsych eval ever could. So getting our community to recognize, okay, it's the huh? The what? It's not that they can't hear us. It's that we were probably saying things so fast that they didn't
Yeah.
follow. We need to slow down our rate. And so, educating our professionals, like these are how And many of these youth are not going to come to you, or survivors of victim domestic violence are going to come to you and say they don't know that they don't know what they don't know. They don't know that that's related to brain injury. So it's our job to kind of help give them.
Mm-hmm. So I think we've kind of been talking about this, but if we're thinking about education in the community for educators, those in the juvenile detention center, wherever they might be, what do you wish that those people understood about these youth?
I wish they understood, again, is it a wound or can't? And to ask the question, not just, do you have a brain injury? Because most folks are not going to identify as that. You have to go into the questions. Have you ever hit your head? You ever had a loss of consciousness? I love the screeners. The screeners don't take long. But we've all hit our heads, but that doesn't mean we've all had brain injuries. What we're looking for, was there an altered state of consciousness? Were you dazed or confused? You don't have to have a loss of consciousness, but problems with memory. We want those educators or those individuals to go, gosh, they had that happen. And not to wait for somebody to say, I've had a brain injury. So understanding what the questions are, I think, is one thing I wish that people would know.
Yeah.
And then not be scared of their answers, and you don't have to be a brain injury expert. But what I do want you to know is to figure out, okay, I wonder if that's a brain injury, and let's start having the conversation. Call the Brain Injury Association and make this list of things to be considered. I encourage the family to talk to their primary care physician about it. Start learning more. And not just assume it's behavioral health.
Yeah. That's one question that I've had to rephrase a little bit in clinic. Is one of the questions is, have you ever had a previous head injury or concussion? And many people have never been diagnosed with it. So they're like, well, no, not that I've been diagnosed, or no, I don't think so. And it's not even, have you hit your head at times, because only about half of people actually hit their head. The rest are from whiplash injuries. So many concussions happen when people don't even hit their head. And so you have this injury from just the movement of your brain inside of your skull. And no, you don't have to lose consciousness. Only about 10%, Lewis research is saying maybe even less than 10% lose consciousness. So I think we're asking the wrong questions on a regular basis.
You're right. Absolutely.
In healthcare, in the community, in all of these places.
And I think for this higher risk population, the other thing you just really, you have to ask is those anoxic and hypoxic injuries. The world it's an opioid overdose. Did you need to be resuscitated? You went without oxygen to your brain for a period of time. We had one, we'd also been working with our regional centers, which is our state hospital, and asking them to do some screening. So they've been doing a great job with that too. But, I can remember our initial meeting with one of the clinicians. She was this well-versed psychologist. She works with folks that she looks like depression, the suicide attempts through hanging. She's like, I never that caused a brain injury, and how it's your memory centers, that lack of oxygen. She's like, it's like light bulb goes on over it.
Yeah. Yeah. Well, that comes back to the intimate partner violence too, domestic abuse. I've had several patients, unfortunately, that have had that experience, and they've had strangulations. They've had other things that would potentially cause the anoxic injury instead of just the regular, or in addition to the regular traumatic brain injury we think of.
I always try to share a story. We had a little guy that had a brain tumor removed when he was a wee little, and tumor removed, neurosurgeons like, we did it. We got the tumor. He's good. Never went on for rehab to have any conversation about how developmentally he might not be on the same route as others. Or he gets into first or second grade and he has delayed processing. So teachers are like, the kid's not paying attention. He's not answering our questions as he's supposed to. So naughty little boy going to be sent to the principal's office for not paying attention.
Yeah.
Well, he did get some neuropsych testing. There was an indicator.
Yeah.
Of a delayed processing. That looks completely different. That teacher has to pause and give him time to think versus I'm sending him to the office because he's not paying attention. It's like, we can't just, we need to understand how that's going to change our brains. And so and nowhere along the way, God bless the neurosurgeons for getting the tumor, but nowhere along the way was there any conversation that family recalls anyway, that he's going to develop differently.
Yeah. Yeah. I've had a couple of adults that have had surgeries, and they woke up from surgery acting like they had TBIs because they have the same symptoms. And so they're in my clinic as acquired brain injuries. It's not a traumatic, but they woke up from surgery with those brain injury symptoms. And it can happen at any age. It's when you mess with the brains,
Yeah.
anything can happen.
Yeah. Yeah.
Mhm.
So we just do a lot of education, a lot of
Yeah.
venting, and just get it on your radar, folks. That's all we
Yeah.
ask. Get it on
Yeah.
your-
What do you hope to see for the future of TBI?
No, well, for TBI and all acquired, and you said it
Yeah.
earlier, Mandy,
Yeah.
for all acquired injuries, just that we have a community that is not scared of the word traumatic brain injury or acquired brain injury, that they kind of go, okay, I know a little bit about it. It's nothing to be, and it's not a medical issue. It is a social issue. And how many more folks have brain injuries than had breast cancer? And yet we all wear pink month of October for Breast Cancer Awareness Month.
Yeah.
I'm happy for that, truly happy for that. But dang on it, there's so many more folks living with brain injury than breast cancer. We as a community, as a nation, don't pay attention. And we think it's a medical condition. And I think the other thing and there's been more and more talk, and Mandy, you know this better than others, it's dynamic. And it changes. So you have a good day and you have a bad day. And just because you had a good day doesn't mean it's all okay. It is truly changing and dynamic. And that for some, it is a chronic condition. And we need to give people grace and support regardless of when their injury was. That's my wish, that we as a community understood that and did a better job.
Yeah.
The needs of folks.
Yeah, we have a lot of work to get to those wishes, but I think it's a very valid and noble wish. So I'm hoping we can get there at some point.
Yes, me too.
So we are wrapping up our end of our time. Where can people find you, the Brain Injury Association, so that they can learn more about the resources and everything that you guys provide?
Yeah, for us, if you Google Brain Injury Nebraska, you're probably going to find us, but our website is the
Awesome. And I do have the other social medias that you sent me. I will include all of those in the show notes so that you don't have to worry about writing them down for anybody who's listening. But there's Facebook, Instagram, and LinkedIn, and I'll have those all on there too. So all pretty easy. It's all Brain Injury Nebraska, essentially. So yeah, we'll get you there. No problems. And any last little bits of wisdom, anything that you would like to share as we wrap up today?
we all need to just learn more about it. And thank you for doing what you do, Mandy. This is great. We need more Mandys out there talking about it and trying to get the message out there. So I really appreciate this opportunity.
Absolutely. Thank you so much for being here today, Peggy.
Yes, thank you.
Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, leave a comment, and share it so that others can benefit. Please also consider supporting the show by buying me a coffee. The link is in the show notes. You can also go to www.brainwellnesssolutions.com to catch the latest info and get links on all of the social medias there. See you next time.